but very fine. If there's a resistance, you can retire and do it again until you feel a little cracking. This is the dissection of this glabellar area. So before to inject anything, I begin with this little dissection for each side of the wrinkle, to the right and the left side of the wrinkle, and then the other side. And with this first dissection, I create a safety plane between the skin and perhaps some vessels, because I made a little dissection, but very slowly, very gently. And then I can inject after my product. This is Apriline normal with lidocaine. It will be more comfortable for the patients. And then I will, resistance, I stop and I retire and I do it again until I feel this little cracking. Okay, then I pass. I'm just, on the same level than my wrinkles, and I can inject the product without any risk with this 25 gauge cannula, and I can do it here. And I feel, make a massage to restore the volume of this glabellar area. And then you have, a Botox effect, because you make a separation, you make a division between the skin and the muscles, and you inject a plane of product between the muscle and the skin. So the contraction of the muscle will have less effect on the skin because of this type of dissection and injection. So you see the first result, this wrinkle disappeared, and then I will finish my injections here, and I feel in that case 0.2 will be enough in my opinion, but I do it very slowly. I did 0.1 and I will inject the rest, 0.2 for the deep plane. Okay, 0.2. The same with the needle, the same syringe with the needle. And then, I'm safe. I restore the volume and I injected a plane between the sub-skin plane and the deep plane. So if I do now with the same product a very superficial injections to finish, the treatment, very superficial, and then you see that like blanching technique, I will inject the rest of my wrinkles. And then at the end, can you France, Madame, pouvez froncer un peu? Oui. You have less contraction because you have a Botox effect, because I can stop now, and vous pouvez arrêter? Merci. And then you see the treatment, and without any risk in this area. So it's okay for this, the cannula here. So 0.25, to treat here, and a good result, pre-hole, good result, and then, tiens, tu mets un petit peu de compresse, une compresse un peu glacée. Oui, oui. Tu me la donnes d'abord. Voilà, super. On va mettre ça là. And first, tu me donnes ça, et tu m'amènes le squelette, la tête. La tête. Okay. So now, I showed you previously, I want to inject around here, the orbital rim, in the submuscular plane, because there's a little piece of fat, or deep fat here, called the roof. So I made this pre-hole with my needle. I will use the same product. I'm around the eyes, and I will use the same Apriline normal. Okay.
You're using again the 25 cannula?
Yes, 25. Okay. And then near the bone, I check with my finger, I'm near the bone, so I'm in a good plane. And I go, can you put it on un peu vers moi, comme ça. I follow the orbital rim with a little, rolling technique, rolling injections, and make this little dissection. If there's a resistance, remember my video, if there's a resistance here, perhaps you can have a nerve or a vessel, so you retire and you try to find another plane. Another plane, okay, and then I'm here, you see the tip of my cannula, and I can follow it until the internal part, and I'm here. I'm exactly what I want to be. So now I retire and I inject 0.2 max of product here. When I retire, like this, like this. Okay. Perfect. Not too much. Just to obtain a little elevation of the lateral part of the eyebrow and to fill this part of the upper orbital area. You see, injection here to fill it, and you make a massage to obtain a good diffusion of the product, and you see a good support of the eyebrow and a little elevation. So the pre-hole, now we'll do the same in the tear straps. So I'm near the bone, I touch the bone. I have no risk here with the infraorbital pedicles, and I'm in the souffle, not in the roof in that case, but in the souffle. So the suborbito-oculi fat. Try to find a good hole, because this is okay. And then the same, I touch the bone, the patient knows that I touch the bone, it's a little bit painful, and then I'm here, I'm exactly below my finger, very high, you know, in the dark circle with the same product. I'm on a good plane because I'm near the bone, I'm between the two ligaments, the two tear straps ligaments, and I can inject here 0. Perhaps 15 in that case. Okay. And it's enough for this. So now, because I have perhaps, I don't know if I have the time to make the two sides on direct. So I will, donc le forte, Apriline forte with the needle. Then I did the glabellar area, I did the roof, I did the souffle. But I want to obtain a little better elevation here. So even if I injected the tear straps, I want to obtain the squelette. I want now to inject this part of the roof, to project and elevate this malar area. So I inject, you know, my finger protect the eye, I inject in the lateral part, I touch the bone, turn my needle in the upper part, and I will inject a bolus here of 0.2. And then a second one here, 0.1, and then 0.1 for this side. It's okay. Perfect. And then I make a massage to push the product very high, but very hard massage. I want to push the product near the ORL, the orbicularis retaining ligament. I want my product to be very high. It will not cross the ORL and will not go in the orbit, but it will stay near the ORL. And you see that with this type of position of the product, with a good cross-link product like the Apriline Forte, you see the definition now of this lateral part of the malar area. Then, perhaps the same product with needle. Yeah, Apriline Forte, no, sorry, with the cannula for the nasolabial fold. So I will inject, how many times I have?
8 minutes.
8 minutes, so very quick. This is a challenge, huh, Mario? You are crazy. You are crazy. Full face in. Well. Allez. Alors, so now the same, you know, danger zone. Remember the artery on my lectures. So the same, you know, approach then for the glabellar area. First, you make a dissection, and you create this safety plane between the skin and perhaps an artery, or perhaps not, but perhaps an artery. And then when you finish your little dissection, then you can inject, for example, here, 0.5, so 0.5 here. So I will inject 0.3 in the nasolabial fold, and the end of my syringe here in the lateral commissure, but the same, no risk here, because I do it with a cannula to correct this depression. So I will finish in 1 minute. I want Apriline 40 with needle and 27 gauge needle. Then I want to finish with the jawline, inject the chin, the angle of the mandibular area, and the lateral part of this little depression, lateral depression here near the chin. So 3 bolus, because sometimes there's a good news in the anatomy. There's a real safe area in this area when you exactly on the middle and you touch the bone and you don't move, you stay near the bone. Here in this deep fat, you can make, for example, here a 0.4, it's a big bolus, and 0.4 Apriline injections, Apriline 40, and then you will see very quickly the projection of the chin and the improvement of, you know, the jawline. And then you will improve it by an injection in this little here depression, 0.1. And then to improve the angle of the mandibular area, you touch, tu peux venir avec le squelette? Okay, it's finished. You touch mandibular line, this, you touch the bone and inject near the bone here, 0.15, and it's finished. And then you see that in this side, we treated the jawline, the projection of the chin, the improvement of the angle of the mandibular area, the nasolabial fold of the magnet line. You look the good definition and the good projection of the malar area with the dark circle treatment, good position of the upper eyebrow, lateral eyebrow, and the glabellar line. And thank you, madam.
Fantastic. Thank you to the patient. Thank you, Dr.